Hey guys, welcome back. Today I'm going to be talking about the cuboid. The cuboid is a bone in your foot and you can hurt it very easily by easily twisting your ankle or just wearing the wrong type of shoe for one day. It feels like you're getting a sharp ice pick going into the side of your foot and sometimes can be mistaken for a fracture and you'll be put in a boot for 6 weeks. I'm going to show you how to fix that, where the cuboid is, on today's video. Stay tuned. Hey guys, welcome back. Jorge Guerrero, Doctor of Physical Therapy, aka Dr. G. Just like I promised, the cuboid. So the cuboid is one of the bones of your midfoot. Now, in your foot, you have 5 shafts, 1, 2, 3, 4, 5. And then you have 3 cuneiforms, right? They all have the same name. Then you have a navicular bone. And then right here on the lateral side, you have the cuboid. Now, these 5 bones in the midfoot, they're actually what provides the structure of your arch. Now, there are muscles, there is fascia, there's other soft tissues that help provide that support, but this bony structure is like a stone column. It provides some of the shape to your arch. Now, if you have a muscle imbalance, if you have weak hips, if you don't have proper alignment throughout the entire leg, over time, what happens is the arch falls and all these bones become stiff. Now, when you feel pain on the outside of the foot because of the cuboid not moving properly, it'll feel like you're getting a sharp stabbing pain over the side of the foot. And it's very, very sharp. You cannot push off of it. So let me show you what that looks like and where it's located on someone. So here I have a left foot, right? And the cuboid's going to be located right there. Just like that, okay? Now the sharp pain can be felt around the ankle area and around there, okay? Now, the cuboid is a gliding bone, so it should move up and down, right, to accept ground, okay? So when someone comes in with a report of a sharp pain to the side of their foot, I will assess that cuboid by putting the foot, and this is for any physical therapist or any healthcare provider that might be watching. I'll grab that bone and I'll palpate around the border. And if it's truly involved, the person will say, hey, that's where the pain is at. Now the next step would be assessing for the mobility of the cuboid. Now, there's some arguments out there about which way the cuboid can be stuck. Can the cuboid be stuck up or can the cuboid be stuck down? Both. I'll tell you this, one's more rare than the other. Usually, it's very rare to see someone with the cuboid kind of pushed up. It's always fallen, more times than not. So, what do you do? What do you do if you have this symptom? Okay, well, one, if you have access to a manual therapist or someone that can do adjustments to the foot, you can get the cuboid adjusted. Okay, it's a very simple technique. I'm about to show it to you right now. All you have to do is apply pressure to the underside of the cuboid and give it a little whip, and it falls right back into place. It feels better, but then you have to stretch the foot out and make sure everything else is feeling good. Okay, so still on the left foot. Okay, so I'm gonna put my thumb over thumb. Okay, just like that. I'm gonna apply downward pressure. My fingers are wrapped around the ankle part. Okay, and there's my pressure. Now sometimes if that cuboid's lodged in there, okay? It'll go real easily just by me applying pressure this way. Now, the pressure should be applied in a J form. So if my pressure is here, I'm gonna go that way, okay? Now you have to be careful. If you haven't been trained in how to do this, you can cause some damage to the ankle, okay? You don't wanna strain or sprain anything on the outside of the ankle, okay? So with two fingers on the cuboid, I just give it a little whip, just like that. I'll show you again, just like that. I'll do it on the right foot just for show purposes. And of course here, it's still the J shape, but now it's on the right foot. Okay, so let's say you don't have access to a physical therapist or someone that knows how to manipulate the foot, then your next best bet is your lacrosse ball and your foam roller, okay? So with the lacrosse ball, what you do is, without a shoe, it's painful. You place that lacrosse ball right on the outside of the foot and you're gonna roll that out, okay? And it does not feel good, okay? Which is why I prefer the foam roller. So with the foam roller, you're gonna do the exact same thing. You're gonna roll your feet maybe for about 3 to 5 minutes, okay? And it feels good. The problem is that if that cuboid is really lodged in there, it's not gonna be enough. You're gonna have to do it more frequently than not. So 2-3 times a day, do it until that pain disappears. Now, if you did twist your ankle and there's bruising, or if you fell off of something and the outside of your foot hurts, then you need an X-ray. But if your foot just starts hurting out of the blue for no reason at all and there's no trauma, then it might be the drop cuboid. Just use your best judgment. Okay, so that's today's video. I hope it helps. The cuboid is very, very frequently diagnosed, misdiagnosed. Sometimes it's not even looked for. So hopefully if you're suffering from this, it can give you a little insight into what's happening in your foot, okay? So Dr. G, Catalyst Physical Therapy, signing out.